We can't throw away our bad experiences, but we can create lessons from them. When I went for a test, they said words I couldn't comprehend, with meanings I couldn't quite process. Definition, phrases, actions, all lengthy, all frightening, all to which I had no clue. It wouldn't take long. It's only going to take a moment. It's like ripping off a plaster, short and sweet. Children younger than you have done it. Come on, be brave. This is not quite what I imagined. Silent pressure. Fear that rumbles in my stomach. Frustration which trickles as sweat against my skin. Fright to what's about to come my way. I don't like it here. It's all so strange. Uncomfortable, uncommon, unusual. What's going on? Why are my mum's emotions so fake? Who are these people carrying shapes of some sort? Stay still, don't move. Babies can do this, therefore so can you. I don't think I can breathe. Trapped, forced, unnoticed. I can't do this. Why are they torturing me? Shall we sing a song? Play with this toy. I'll get you some bubbles. There's a prize waiting for you. Just stay still. Don't move. Stop it. All I want is to be understood, recognised, reassured. Am I being so unreasonable for wanting to be heard? Numbness travels through my body. I don't think I have a choice. I cry, but I feel nothing. Just as empty. I had no clue. Take a sticker. We're all done. See you next time. Praise is no good. Scared, alone, misunderstood. The tears that stream down from my cheek onto the sticker I will eventually lose. Like the hope I had when I entered the room. The stare from my mum leads me to say thank you. But I feel scared by the one sentence that sticks. See, you, next, time. To which my mind replays all the frightening steps that led me to what happened. Not wanting to return makes me question, am I abnormal to feel so lonely for the crime that went on, without any knowledge to why I was chosen as the victim?
Since I was 18 months old and throughout my childhood, I've experienced a lot of bad experiences with medical procedures. I've been held down for anaesthetics, had procedures rushed and not been told what was happening, and felt ignored during them. These memories have overshadowed the happiness kids should have. My mum noticed something was wrong early on and tried to get me help. But the healthcare team didn't listen until it was too late. I was always too young to remember anything in the medical professional's eyes. I became distressed, distant, and depressed as a child. After so many bad experiences, I started to refuse medical help, have nightmares, and each visit was distressing beyond belief. It's not just hard for me, but for my family and nurses too. It's affected my life in so many ways, my schooling, friendships, and just having fun as a child, and even through my teenage years. Now, at 23, I've tried everything to cope, but still need medication for every visit to help calm me. I can't go alone, I avoid the emergency room, and it limits my treatment options for my health condition. It'll even make having my own children difficult because of the procedures involved in that. I feel alone, misunderstood, and judged. Every medical visit leaves me a mess, even now. I am proof that one badly handled procedure can have lasting effects, but also many can really mess up a person's life. I wish my trauma would go away, but now I just have to learn to live with it.
Hello, my name is Jana Abuta, medically known as chronic neuropathic pain, Crohn's disease, and chronic constipation. The labels stamped next to my name hold more than just my diagnosis, but tell a story of the profound impact poor practice has had on my life. I'd like to share with you some of my emotional struggles I encountered during my medical journey, along with some parts of my book. At the core of my message lies the simple truth. The care a child receives during their time in hospital profoundly shapes their feelings and experiences. My experiences have shaped the way I am now able to be vulnerable and to trust. Vulnerability is always safer kept within the boundaries of your own pain. The explanations are always too long for yourself to register. Don't cry, don't have a flare-up, control yourself. This is just going to embarrass you. My experiences have broken my system of being human and left me trying to rebuild the ability to understand my own emotions. The truth of the matter is I don't think I'll ever be able to share the complete emotional journey I went through in hospital, the depth of my struggles. It was also confused to how these doctors thought, and maybe if just one doctor could feel the pain I feel, I wouldn't be so lost among the wards of this hospital. Everything could have been made better, just by the simple act of listening and understanding. The security I thought I once had was dismantled admission after admission. I didn't have the strength or capabilities to cry like a normal human. My emotions were left muddled as soon as I left the automatic doors of that hospital. Each time I leave those doors, I seem to be more broken than when I entered. They doubted the pain I was in, questioned my symptoms, or simply ignored the way I felt. I was completely ignored, until one of them spoke the words that cut the deepest. During her laugh, "You should be in a psychiatric hospital, not here with patients who are ill." Ouch. I not only lost trust, but lost myself amongst the interactions that were meant to fix me, not break me. No communication meant fewer chances of feeling the stinging of people's words and opinions. Could no one see how destroyed I was? In my opinion, the way a child feels is far more valid than any health-related issue they come in with. Communication was undiscovered in the realms of the hospital. Everyone was fixing a different part of me, but no one was bringing the pieces of construction together. Communication, the things we learn in primary school, to talk to each other, make friends, not to forget we have other voices and opinions around us. Without communication, without support, I feared my pain. It was unusual, and without answers to back it up, I felt stupid. The opinions of nurses and others didn't help also. I was being watched, judged for the pain I was in. Not only did this make the anger in my screams enlarge, but added to the pit of emptiness in me. If there wasn't this, I wasn't in pain. There are no signs of tears yet. She isn't in pain. Try paracetamol first. It may work. Morphine's too strong. Do you not think she's over-exaggerating it? No one understood, not even the nurses who were meant to care for me. What makes the difference between the white coats? Not the qualifications, but those who try and make sure that every child feels secure during their stay in hospital. Some might say this is all so far-fetched coming from a 16-year-old, but this is my experience and my medical journey, which spans multiple specialities and enduring persistent trauma. It is the rare instances of unwavering moral kindness that have given me the resilience to reclaim trust in the healthcare system that once seemed distant and unattainable. Without the few people who have validated my feelings and worked to improve the way I felt, I wouldn't have the hope I do today. There are few professionals who are different. She made it clear she was fully involved in my care, not the type to see me once and never return. This all meant when she came in, I gave her the time of day, and I hoped I showed her a little more respect. Her arrival made it all more evident. She showed up in her scrubs. From her own valuable time after an on-call in surgery, she came to see me. Jana, the rude patient, she must care for her patients a lot. Through her actions and choices of words, it made me feel as if I could trust her and her opinions. 2 hours of her rest I took from her, and not once did she rush it to speed it all up. I felt for the first time I had a voice worthy of a doctor to listen to. I clearly misjudged her, as her kindness that day is something that would last with me forever, a key moment in my chronic illness journey. In the journey of regaining confidence, I managed to write a book based on my chronic illness journey, called I Am in Pain, and I continually write poetry to express the troubles of having an invisible illness. I think that's what affects me most, the thought of showing vulnerability to someone and get nothing in return, or even worse, for all to be used against me. One thing that struck me on reflecting of everything I've been through is the constant worthlessness I feel as a result of being ignored. Why should I carry on screaming if no one seems to care? Why should I suffer if it wasn't an emergency to them? I hope my words have shed a light on the transformative impact of acknowledging and valuing a child's emotional experience within healthcare. It is so important to recognise and validate all children's feelings, and to never lose sight of the unique individuals behind each diagnosis or treatment. I hope my reflections serve as a catalyst for collective introspection, prompting a shared commitment to prioritise compassion, empathy, and excellence in medical care. Let's embrace the simplicity of listening and communicating as potent tools to prevent the emotional turmoil of feeling disregarded, ignored, and invisible. I hope by sharing my experiences this way will pave the way towards a more compassionate standard of care. Thank you.
I think that it is important that doctors don't treat younger patients like they are stupid, and so they should use medical language to describe their patient's diagnosis. And if they are unsure of what it means, then they can ask or look it up. Treating me like a person and not just a patient makes me feel more comfortable. I felt nervous about needles. Talk to me, show me what you're going to do. Symbols, sentences help me.
Let me bring my teddy. Treat me nice. I like to know what they do. I like to know what is happening. I like it when they speak to me. Doctors should always be clear and upfront about what's happening.
Please help children understand what procedure they are going to have and help them enjoy their time.
To doctor, don't do it too hard. Try and make it more welcoming for the children and put toys in there.
Having good bedside manners means treating someone with kindness and understanding when they're going through medical procedures. It's about that friendly smile, being gentle and not rushing the process. It's important for medical staff to listen, take their time and respect the patient's feelings and preferences. They should talk to the person like they're normal and get to know them and even make them laugh. Creating that comfortable environment where it's okay to show emotion and be supported by loved ones is crucial. Judgment-free care, like when using numbing cream, is also essential. These simple gestures can make a huge difference in helping patients cope. Children are not robots. They have feelings just like adults do, so treat them the way you would treat an adult. Even though my trauma might not have an end, I can use my experiences to advocate for others, especially children who are going through the similar struggles. By speaking out and raising awareness, I can help create support systems and let others know they are not alone. This sense of community is incredibly powerful and can make a huge difference for everyone involved.
when I went for a test. I was scared to begin, terrified even, the busy people all around me, my mum holding my hand a bit too tight, huddled, noisy, loud. But then I saw a big smile among the white jackets. The amplified noises were silenced. The slow, steady pace of words, short, sweet, honest. I wasn't so worried. I was given a big thumbs up. It might be tricky, they said, but I'm strong enough. I'm here if you want to stop. Just give me a tap and no more will come. Just let me know if it's all too much. Do you have any questions? If so, don't be shy. I asked away. The comfort of knowing I was understood. I don't mind being here. I feel safe in that smile. As they hum a song, it might be a bit uncomfortable, but I'm supported, and that's all that matters. I'm ready when you are. There's no rush. Slow, deep breaths. It won't last very long. Squeeze my hand. Give me a hug. You've got this. I'm proud you've made it. And together we can make it. I don't feel so alone. Let's count together. 1, 2, 3. Well done. It's all over. I knew you could do it. You should be proud of yourself. It's not so easy what you have done. In the midst of the pain, I was supported enough to feel powerful.